Hi, this is Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this series, this trauma and healing series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Today, in one of a series of Brother Be Well conversations on trauma and healing, made possible by the support of Blue Shield of California's Blue Sky Initiative, we're talking about the myriad of behaviors that are often associated with unresolved trauma. Trauma is something that's not to be ignored. As we've addressed in other podcasts in this series, it can cause a host of serious mental and physical health problems. As we'll discuss today, unresolved trauma can also lead to a number of self destructive behaviors that you'll want to avoid and that can signal that you or a loved one may be struggling. To help us unpack a whole lot of information in a short period of time, we've got marriage and family therapist and Brother Be Well clinical advisor Christian Jacobs with us. Christian, welcome back to Brother Be Well.
Hi, Mike. Thanks for having me back.
Really good to be here. Let's get right at this if you don't mind, sir. We've got a lot to talk about.
I'm
Start
ready.
start us out, man. Describe or define rather trauma for the Brother Be Well family. For me, looking back, I used to think of trauma as a blunt force, to the head, a physical trauma. But talk about frame trauma for us through the mental health lens for our discussion today.
Sure. And absolutely, you're correct. That is one form of, trauma is, the physical, blunt force trauma, car accidents, things of that sort. But trauma is also defined initially, as an emotional and psychological response to a traumatic event, such as violence, racism, as we talked about in the past, being involved and witnessing school shootings. So that's also a new phenomenon in terms of experiencing trauma, car accidents, domestic violence, sexual abuse, rape. A person experiencing delayed, that delayed shock and denial after the traumatic event is really common as well. So that's why a lot of times there's a diagnosis when we're looking at PTSD is how long it's been prevalent for, and if it's longer than a month, because sometimes it takes a while to really develop. And also, trauma can occur from direct exposure. This is something else that people may not be aware of, is that trauma occurs either from direct exposure, witnessing the trauma. So it may not have happened to you, but you witnessed it, you've seen it with your own eyes. And also the fact that trauma can occur not even from you seeing it, but learning that a close friend or family was exposed to it as well. So just by hearing about it or hearing the story of someone kind of explain to you, what happened to grandma, in the home before she passed away, indirect exposure is what it's called. And even direct exposure, such as something being connected to your job, such as being a firefighter or police officers and things of that sort, what they see on a day-to-day basis.
It's interesting, Christian. I'm learning that often signs of trauma and recognizing them can be challenging. Sometimes people who are having difficulties enter therapy, even. We've talked about this before, without really knowing that they've suffered the very trauma that's causing a disruption or holding them back in their daily life. As a marriage and family therapist, if you don't mind, can you have you seen that among the people that you've treated?
Yes, it's very common actually, Michael. Recognizing the signs of trauma can really be tricky, because the symptoms can be delayed, as I was saying before, several months after the incident occurred, or what I see in everyday practice is a person comes into therapy, for one issue, and then, you're working through that issue and the presenting problem. You think you have, a good understanding of what's going on. And then all of a sudden, maybe 3 months down the road, a client is triggered by a traumatic unrelated event that was unresolved. So now you're looking at several layers of healing that you're facing in terms of treatment. So as a therapist, the heavy lift really comes in sessions where you need to really assess whether or not they're in that denial stage of the trauma, right? They're not really accepting it. They may not see that what happened was traumatic. And B, once they really accepted it, working with them to process that trauma and see how it really has impacted their daily life. So now you have to go back with them, and meet them where they are in terms of seeing how, now that you're aware of what's happened, how has this affected you in your last 10, 20, 30 plus years.
I'm going to quote as we move through this conversation, Christian. I'm going to quote another respected mental health professional, just like you. His name is Dr. Peter A. Levine. He's treated and researched trauma for over 50 years now. This is a quote from him: "The effects of unresolved trauma can be devastating. It can affect our habits and outlook on life, leading to addictions and poor decision making. It can take a toll on our family life and interpersonal relationships. It can trigger real physical pain, symptoms, and disease, and it can lead to a range of self destructive behaviors." Let's get at those behaviors, Christian, if you don't mind. I know two of them from firsthand experience are anxiety and depression. Can you please talk about those and some of the other behaviors, or the manifestations, I should say, of anxiety and depression, or two of those behaviors? Can you talk about other behaviors that can arise from unresolved trauma?
Sure, where Dr. Levine is absolutely correct. He's accurate on that. And as you see, that some of the things he named, it literally affects pretty much your whole life, right? It affects, holistically everything that goes on with you, psychologically, socially, physically, emotionally. So he's absolutely accurate on that. And really, depression is really prevalent with those who've experienced trauma, because, individuals who have experienced traumatic experiences really internalize the event, right? So you have that denial that happens a lot. Then now they're internalizing the event, and have subsequently really those negative thoughts about themselves, or they may generalize the event and have negative thoughts about the world. So that's where the cycle of how depression can really manifest from experiencing trauma or PTSD. So you have the delay, potential delay, you have the potential denial, and then you have the effects of what's occurred over that time of being in denial, or that delay in understanding that you've been traumatized. And also, individuals may also experience avoidance of social situations that may be more related to traumatic symptoms, than a fear of embarrassment. So now you have isolation. Now you're isolating yourself, socially. And anxiety, now we're talking about anxiety. Anxiety and avoidance, are very are related in a sense, and connected, within individuals with PTSD. One of the pillars of treatment in PTSD is to break the cycle of avoidance. So, they may be avoiding certain people because maybe they think, oh, they know that I'm, paranoid, so I'm not going to go around people. So now they're isolating. So now there's a level of anxiety, or social anxiety, or social avoidance because of that reason. And actually, it's naturally reinforcing, because individuals who avoid anxiety provoking situations or thoughts experience a decrease in anxiety. So you want them to try and get out there and do in vivo, which is show them up front and put them in that environment and have them confront what's scaring them or what's causing anxiety. But that's one of the treatment methods. But research has also found a strong link between exposure to traumatic events and substance use disorders too. So Wall Mind talks about their research being done. Up to 50% of adults with both alcohol use and disorders related to PTSD have one or more other serious psychological or physical conditions, including those anxiety disorders we talked about, the mood disorders, diabetes, things of that sort. And also, you see individuals in this situation will self-medicate as well. And then you have the high risk individuals who people who are more high risk of using because of the PTSD and the delay of understanding their issue and the denial. So these are some of the it's a unperfect storm, is another way to say it, of situations that could happen when you have PTSD and denial and some of these potential substance abuse and the high risk components here.
I want to make sure we're really digging as deeply as we need to on this particular question, Christian. You've touched on so much of what I wanted to get at: avoidance, feelings of detachment, dissociation. Can you talk about why those behaviors are so very destructive? I mean, I know that, or think I know, those can really shut your life down. Really, we're not talking about just something that there's a casual inconvenience or something that might be a little irritating. These are the behaviors that you can settle into as a result of trauma that's not being addressed can really shut you, the walls start to close in, and your life can start to shut down. Yes.
Oh, yeah, absolutely. You said it great. You described it really well in your explanation, in your definition of them. Excuse me. But I'll add that many of these things you listed occur due to the person either daydreaming, so they're in a fog, or they're in a gaze, or they're having flashbacks, about the incident or the emotional pain related to trauma. So they really become detached from the world. So they're almost like they're floating through life and the here and now of living, right? Which is why treatment methods that help PTSD patients stay in the here and now, right? In the current time. So here and now is really staying in the current time. That person with PTSD is living in the past, what happened to them, things of that sort. As a treatment method, you want to get them in that here and now moment. What's going on with them currently? How are they feeling now? That strength base. What is going on with you now that's positive? How have you thrived? How have you been a resilient person to make it to where you're at now? And it's been proven to be effective. And like we go back to one of our original podcasts, the EMDR, which is an eye movement desensitization and reprocessing. These are some of the effective modalities that can help you when you're experiencing PTSD and trauma and stress.
I need to get a T-shirt, Christian, with EMDR on it, because every time you bring it up, I feel like talking about that, and it's such a, for me, a transformative modality. I really refer to EMDR as having given me my life back, and I got a chance to tell my therapist that she literally gave me my life back. That's how it felt. So if you're curious about that, go to brotherbewell.com. You can check out that conversation that Christian Jacobs and I had on EMDR. Christian, have we touched on all of the unresolved behaviors? Have we touched on all the behaviors that stem from unresolved or untreated trauma, or have I missed something? Any others that you can think of for someone watching this video?
I think one behavior that I think is very, very important, and it's about relationships. And I bring this up because I think many loved ones are the main culprits of the trauma, the secondary trauma they experience from someone, from a partner who's experienced trauma. So the individual who's going through something, usually their spouse or loved ones are suffering too, because they're not receiving some of the attention that they need, but they know their loved ones going through something. So unhealthy attachment styles in relationships can really manifest. So as a result, this is a really concerning behavior. A person who is experiencing trauma is more susceptible to like isolating from other people and detaching from those loved ones, and that the trauma can really impact how you attach or bond in relationships. So there's the anxious and preoccupied attachment. I'm really talking about attachment styles now. There's an anxious and preoccupied attachment style where one doesn't like being without company. They're more drama oriented, requires constant validation of love and attention to feel secure, almost to where you can say needy in a sense, feels more nervous and less secure about romantic relationships, where you're going, where you've been. So now you have that paranoia, that can manifest, through, unresolved trauma. Or you have the dismissive attachment style, right? So where one is more passive, they sit back, they're with their partner, but they have commitment issues and they avoid intimacy. So all these things to really be again unperfect, imperfect disaster for a relationship issue. And for example, if you had like parents, right, who were emotionally distant or physically absent when you were a child and you felt abandoned, when your spouse comes home late from work, you may feel powerless or rejected. So these are some examples of how, other behaviors that may manifest through unresolved, untreated trauma.